A urology colleague actually is a friend of mine because we were discussing prostate cancer, and he told me that the blood test is extremely important, and he told me that ejaculation does reduce the risk of prostate cancer. And he actually did raise an alarm about the rates of prostate cancer in this country, that they're extremely high. And
do we have some numbers? What are the numbers like?
I think he was saying like 1 in 4 to 8. So I think Gachagua said 1 to 9 in Africa, but he was saying actually...
In Kenya, actually.
Yeah, so he was saying it between 4 to 8 men. So in other words, almost a quarter to 1/8 of men will die of prostate cancer, which is extremely alarming. Yeah.
The prevention?
Prevention now is the testing. Frequent checkups actually does pick a lot of
lifestyle, for instance. Is there anything? Exercise? I don't know. This thing.
Well, of course, now smoking does contribute to a lot of cancers, alcohol, and so reduction in those. But otherwise, the screening is the most important factor.
How about the treatment?
Treatment now depends on the stage. So if it is found early, surgery can be done. And now we have quite a lot of doctors in Kenya doing those operations. If it's late means it could have spread to the bones, to the lungs, to the liver, then now mainly chemotherapy. Sometimes they do surgery just to allow the urine, somebody to pass urine, because it has blocked the urethra. But mainly now radiotherapy and chemotherapy would come in for the more advanced stages.
How about prostatectomy?
Yes, so prostatectomy is now the removal of the prostate, but that is only if it's an early stage, meaning it's confined, so you can remove all of it. But now if it has left the prostate and gone further away, then that surgery alone would not remove everything. So you'll remove the prostate, but you'll leave some tumor either in the lymph nodes or in the bones, which would need further treatment.
And there's a question that is intertwined to that, which I guess I already have the answer. Can one live without a prostate?
Yes.
Most definitely they
can. Yeah. Of course, the condition does affect men who are a bit older in age. It's very rare to get it below 40. And so, because in a man who has had the surgery, the ejaculation is retrograde, meaning the man will now not ejaculate outwards, it will go inwards. So, in other words, he'll not be able to sire children after the operation. Yeah. So fortunately, this is a man who has already had the number of children that he wanted.
But if it happens to someone who has not,
then that would be a problem.
Too bad. Okay, we have so much to talk about with so little time. 12 minutes left. I just can't believe this, but it always happens. I want us to switch gears and talk marriage or relationships, because one of the reasons, or most times, it is said that we, the women, sisi ndo huwa tunawa stress. I don't know why people say that. Is it true? I mean, from your counseling sessions, Dr. Julius, I mean, with the men, have you had them complain about the women? Have you had them complain that tunawapatia pressure unnecessary?
Now, let me say this. Sometimes, of course, pressure can come from different sides. But when a woman, one of the things even the Bible says is, especially when a woman is nagging, that means you keep on saying the same thing so many times. And at the moment it passes 2 times, it has entered into the level of nagging. So I think that bothers men a lot, especially when you tell you tell a man what he needs to do, and you keep on repeating it. Now he feels like you're trying to demean him to be like your son now. And so that bothers a man. The pressure also, as he said, we have also the pressure of provision. And I think we need to demystify provision. Because when God calls us a provider, we provide more than just the resources for the family. We are able to provide the love, which is very important. We provide security. You can have a man sitting in his home and he does nothing much. He provides maybe the resources, but he doesn't talk a lot. But the presence of that man in that home.
Presence and presence.
Yeah, present. He does the present, and maybe not much, but you find the presence of that man creates a security feeling to the children and to the wife. There are people who can't sleep until the man arrives home. And you only realize the power of that provision when the man exits the world. You realize we're being protected. There are women who have downplayed the man who comes home drunk. But the moment that man exits this world and probably dies, that's when they begin to see all the family, the relatives, the uncles, they were being held outside by that man. They now begin to come in and want to take the land, the resources and everything.